I'm dying. And I know that everybody is, but I've recently been diagnosed with stage 4 lung cancer. So my expiration date, my best before label's a little bit earlier than I was hoping for. I'm going to talk today about the diagnosis, the impact it's had on me, and what I'm trying to make as a positive change in my life for whatever future I have left. So, hi, I'm David. I'm 52. I'm from the northeast of England, and I've been diagnosed with what's classed as ALK-positive lung cancer. I'm the sort of person that was never expecting to be getting cancer at this stage of my life. I'm 52, I'm healthy, I never go to the doctors. I've been looking into health, well-being, self-improvement, longevity for probably the last 14, 15 years. 9 years of that I've been plant-based. I've also been a runner for most of that time, so I spent a lot of time training for marathons. I've done multiple ones of them. I've got about 15,000 miles on Strava. I also listen to all the podcasts, read the books, so, Rich Roll, Peter Attia, Huberman, Tim Ferriss quite a lot as well. So I've heard many experts. My aim was to get to 98 with a good health span, not just a lifespan. That was the age my granddad was. I thought it was a good target to be aiming for. So, I thought, well, maybe 40, 50 years left. Apparently that's not the case. So I didn't really have much in the way of symptoms. I'd had a cough that kept coming and going, especially when I was traveling, which I thought was to do mainly with, being in and out of air conditioning. So it was almost like infections and things were coming and going. So in kind of November 2024, I did go and see the practice nurse, and she basically said, well, that's the case. It's just colds coming and going. Nothing to worry about. On you go. I then went back traveling again, and I was in Korea, and I was even 4 or 5 months before diagnosis, I was spending 2-3 hours a day walking or running. I was doing 14, 15 miles a day when I was in Korea. I was in a beautiful place called Busan every day out along the coastline. It was amazing. I was so content. I'd found what I wanted from my life. But I did have a little bit of a wheeze. My mileage times were down a little bit. And the stress, I've got a Garmin watch, so my stress levels and things like that on that were up. So when I came back to the UK, I then went back and saw a proper GP as opposed to the practice nurse. He had a few ideas whether it could have been tuberculosis, for it was kind of what he was thinking as the extreme end, or maybe, just what I'd said, it was just infections coming and going from the various countries and places I'd been. I went for an x-ray straight away. They rang up the next day, which is never a good sign. We need you to come in for a CT scan. We've spotted something on the x-ray. Then got the CT scan, and I got the results through on the GP app, which I put into Claude, and it was basically stage 4. You've got a 7-centimetre tumour on your lung, and part of the lungs collapsed, which is why I was having the stress and things like that. It's classed as metastatic, which means it's moved outside of that initial spot, so it's gone through my lymph nodes and into my other lung as well. What this means is that kind of reduces the treatment options. It puts you onto stage 4 where they can't really do operations. It's classed as terminal, and you're going to be on treatment for the rest of your life. At that point, obviously panic mode sets in. I used AI a lot to kind of understand what was happening, what the process would be next. It was seeing a lung specialist initially, but probably that would end up going through various tests to then end up at an oncologist. That was kind of the way it was going. Yes, there was a chance of it being TB or maybe some other thing that I'd picked up in Asia, but that was a small chance. The next best outcome was some sort of genetic type of cancer, non-smoker. I've never smoked, which there's a multitude of genetic ones, and then there's obviously standard cancer, which is much more like what a smoker would get, and the prognosis for that one is very poor. So there was basically 4 months of, no, sorry, it was 2 to 3 months of testing, going through the process, and it basically turned out that I had what's called ALK-positive lung cancer. It's a genetic type of cancer. It's two genes have fused together that shouldn't have done. They're not totally sure why this happens at the moment, but it's not to do with lifestyle or anything like that. But what it means is it's not something that, like immunotherapy and things like that, can treat. It's not anything that I can do with, because it hides from the immune system. That's one of the other things that it does. So chemo, immunotherapy, some of these new technologies that they're talking about vaccines and things could work, but it's less likely for this type of cancer. Now, the good part of that, well, maybe I'll come to that later on, what the positive part of that is, and when I come to the treatment. It's turned my life upside down. I had aimed to become a digital nomad. I was planning to spend 9 months away from the UK every year. My plan was to have this YouTube channel to be more about, lifestyle change for the 40, 50, 60-year-olds that are perhaps unhappy in the job, in the career, and looking at ways that we can make changes to move into a career that brings us a lot more joy. So that was the plan. I've got a book outline. I've got loads of stuff ready to go on that. But now I'm kind of trapped in the UK. At the minute, I don't have permission to travel from the consultant. Travel costs are going to be higher. And I'm also, and this is really the main problem, I'm now trapped in this cycle of tests. So every month I have to have blood tests, which then gets me 4 more weeks of drugs. So I can take a tablet that's a targeted therapy for the drug, for the condition. So I take that twice a day, but presently they'll only give me 4 weeks. So that's kind of one of the challenges. I can't go away for longer than that. But then even with that, it's 3 monthly CT scans, see the consultant after the CT scans. So you're kind of in a 3-month trap either way. So going away for 9 months is just completely off the table. So how I'm trying to adapt to all of that, and basically the loss of all of my identities, the identity of being healthy, the identity of being a runner. I'm barely exercising at the minute, although I'm trying to build that back up. My identity as a traveller, everything basically has been stripped away from me. So I am trying to rebuild all of those things right now. I have kind of gone, and I'm almost talking back into monk mode, after probably 2 or 3 months of kind of just being off the rails a little bit emotionally and things like that. I'm kind of trying to pull myself together now, look at the ways that I can turn this into, live in the moment, be positive. What can I do in the meantime? There's a lot of people in much worse situations than I'm in. I had a conversation with someone the other day. I've got the best form of lung cancer that you can have. As I said, there's targeted therapy. There's things coming down the line that could make this more of a chronic disease, as long as I get through kind of the first few stages, as long as the drugs work for the first 2 years. And then you get past 5 years, your potential is kind of the same 10, 15 years for someone like me. But there's a percentage, like the median is currently 7 years. And as I said, there's quite a big cutoff of people, unfortunately, where it's kind of 2 years. For some reason, the drugs don't work for them. So that's kind of what I'm looking to do is, as I said, be positive. How can I redefine the things that I was going to do? I'd found my contentment. Okay, I'm not going to have that again. I can't just get up and go. That's the hardest part for me. I feel like I was a wild animal. I could go where I wanted, when I wanted, do what I want. Now I feel like I've got this collar of cancer around my neck, and I'm waiting for the consultant to tell me how long my leader is. Can I have 1 month? Can I have 2 months? 3 months going to be the maximum. That's kind of getting through that part. And I think one of my mantras at the minute, I heard on a podcast where the guy said, whenever you're hitting problems in life, don't reflect on the bad parts about it. Just use the mantra, brave new world, brave new world. It's an opportunity. It's a chance of growth, of change. What can what positive things can come out of it? And there's positive things come out already. A closer relationship with my daughter, who I was close with anyway, but kind of, we've got this expiration date type thing, and it's brought us closer together. We've made some good memories together already. I found out who my close friends are. I'm starting to plan for traveling. I'm starting to think about what I can do, how I can do it. I can go away if I can't go away for 9 months, well, I might be able to go away for 3 weeks. Where can I go? What can I do? What can I do in my daily life that brings that sense of contentment to me that I'd found? It was a simple life. I was just getting up, going for runs, going for walks, having coffee, eating, reading, creating content. That's what I was doing. Going for another walk. It was a simple life. Yes, it was in another country, and that was the advantage, being outdoors, the sunshine, the meeting new people, the change. Spending a month in each place was what I was planning to do. But I can try and bring that somehow into my life now and look for kind of what is going to be my sense of purpose going forward. I can still do a channel. I can still do something. It's going to be a different journey that I'm on now, but I can still use this platform to bring change for other people. How do we deal with changes in our identity? How do we stay positive in the face of the worst things that can be happening? That's kind of what I want to bring and what I want to change from life. So I think I've talked quite a bit now. It's took me quite a few goes to record this video, I'll be honest. And I wanted to do it all in one go, just be as authentic as I can be. And that's my plan for the channel going forward. I think it's going to be a mixture of my health journey. It's going to be a mixture of hopefully traveling. So maybe, little bits of travel vlogs and how you deal, with the change and the power of change that we can still bring into our lives. The change of jobs and stuff like that, I'll still be able to touch on. As I said, I have material all ready to go, but I'm not bothered about the money side anymore, and that was the plan. So that sense of purpose has kind of changed, I guess. That I'm not bothered about sitting for hours and hours at a computer, editing for hours, writing material for hours, creating courses for hours. My priorities changed, but I do want to kind of have a purpose. I want to put something positive out there into the world. So if you've stuck with me this long in the video, please, if you want to, give a like, give a follow, subscribe, and let's see where the journey goes together. Okay, thanks. Bye.